So we are here in
Montserrado
County,
Yeah.
which is the largest county in Liberia, and it's where Monrovia, the capital, is located. And we're here with Dr.
Yatta S. Wapoe.
And Dr. Yatta leads the Montserrado Healthcare Services
Yeah.
for this county,
Yeah.
along with her right-hand man,
What's her name?
Adolfo's Quinta.
Adolfo Skenza. We're really thrilled to be here, and we'd like to ask some questions about healthcare in Montserrado.
Sure.
So, can you first off just give us an idea of how large the population is in this county?
Okay, so Montserrado has a population of approximately 1.4 million people, and it accounts for 1/3 of the country's population. Yeah.
And you, how many hospitals are in the county?
Currently, according to our records, or what we have in the DHIS2, we have 350 healthcare facilities currently in Montserrado.
What are the key issues you deal with? If you could identify the top 3 or 4 healthcare issues that you have in the county, which then also reflects pretty much the country as well. What
Okay.
would be those issues?
So before I go to the issues, besides the number of facilities, of these 300 plus facilities, we have only 50 of these facilities being government owned. The rest are private facilities. So that is one of the major issues, but it's not like a main health issue, but it contributes to the healthcare delivery service negatively in a sense that some of these people we cannot monitor them the way we actually monitors the public facility and tell them you have to do this, you have to do that, you have to do the other.
Yeah.
Because they are private and according to them they're trying to contribute to what government is doing, which we accept. But most of them don't provide the kind of services that we think they should be providing. Because first, they don't employ qualified staff, or the facility is not fit for purpose. IPC standards are not being observed. So
IPP stands for?
the infection prevention control standards are not being observed in these facilities. So we have a lot of issues. But in Montserrado, according to our different reviews that we have had over the past few years, Montserrado accounts for most of the maternal death, about 50% of all of the maternal death that occur in Liberia. And this maternal death happens because of postpartum hemorrhage, which is one of the most important. From postpartum hemorrhage, we have cardiovascular causes or delay from the facility, no medical supplies, etc. Yeah.
So we were talking, this is huge help, but the 3 or 4, if you could identify the 3 or 4 major health issues, could you just?
So maternal death.
Maternal death is kind of
Maternal
number 1?
death is kind of number 1, trying to tackle. We also have a huge neonatal death.
Neonatal?
Yeah, infants. Most
Yeah.
of the babies, yeah, they die before they reach 28 days. Yeah. Most of them die during the birthing process. That's one.
Right.
Yeah. We have issue with childhood diseases. We have measles outbreak back and forth. We also have cardiovascular issues with adults. We realize that most of the adults are dying from chronic diseases that sometimes we tend to overlook, and we say, oh, they are adults, they are doing well, but you see a lot of people dying from cardiovascular accident or stroke, uncontrolled hypertension, diabetes, etc. So most of those chronic conditions are in one category. We have a lot of others dying now. Just last week, we talked about establishing a health club in Montserrado, where in the county health team will launch a healthy living club. And then we have adults and the Ministry of Health to come to support us. We'll create awareness on radio station to encourage people to seek health care as early as possible to prevent some of the deaths.
Okay. And in terms of neonatal care, you're saying that, do you have statistics on that? Or is that something you can share?
Yes, we can share that with you before you leave. We have statistics on that. We have a lot of neonatal death. In fact, last year, we had over 1,000 neonatal deaths in Montserrado.
In this county alone?
Just this county alone, over 1,000. Some of the clinics don't even have electricity before we have outages. Some of them don't have the luxury of having electricity. We have a solar light for only the maternal area.
Okay.
And if it don't shine enough, sometimes it's very dim at night. So you'll find out that whole facility will be practically in darkness. And they tend to shut it down and wait when they have a pregnant woman and they put it on just so they can have some kind of lighting. And because of this key infrastructure issue, you find out a lot of women bleed because of postpartum issues. Most of them maybe they will have a cervical tear that the midwife can adequately identify because of lighting. Because if she identified it early, she'll be able to refer the woman to where she can get help, maybe where she have a doctor to repair that tear. But then you realize that this woman is still bleeding after 30 minutes of giving birth. The uterus will not contract. She continues to bleed. Sometimes she lie there and she bleeds to death because they cannot see properly
To know
what is actually going on. Yeah. We have a maternal task force. We go from one facility to the next to review these maternal deaths. But sometimes it's kind of embarrassing. As a manager, I come to you and say, "Oh, Roger, what is your problem?" And you say, "Oh, Dr. Wapoe, I don't have adequate lighting." And then I say, "Okay, Roger, so do you think that was the cause of your maternal death?" You say, "Yes. If I had adequate lighting, I was going to do X, Y, Z." I say, "Okay, I will go and see what I can do and come back." And I come after a month, you have another maternal death because of the same reason. I'm embarrassed, I cannot face you.
Yeah.
Because obviously when I go to you, you will say, "I don't want to talk to you anymore because I just explained to you 1 month ago that I had this situation and you have not done anything to solve it."
Do you think that sort of that issue of apnea has to do with just people laboring for a long time? For example, if they're in rural areas and they're not getting the baby out as fast as maybe.
It could be a contributing factor, but also some of the midwives try to assist the mother. They gave them Mesoprostol, Satotec.
Oh yeah, okay.
Yeah, sometimes they come to the hospital and then they realize that they just started to labor, and maybe that midwife has been seeing that mother for a long time. And then she say, "Okay, so since she's just 1 cm, and I think I want to deliver her," sometimes she gave Mesoprostol. It's almost like a oxytocin drop that helps the uterus to open and contract each other. Yeah.
So it's back to, it's a drug that's supposed to help induce the labor?
Yeah.
That's what we use it
Exactly.
to induce labor.
So sometimes they overdose them, and then the uterus works over plus and it becomes atonic.
Yep.
And then they also bleed because of that as well. Sometimes they travel from one traditional birth attendant to the next before they present at the hospital. And most of the birth attendants don't use sterile products. So now they even do vaginal exam with the variants. And then by the time you realize the woman is already infected, she have a lot of sepsis. So after she delivers the baby, she's overwhelmed with sepsis. The uterus cannot contract adequately. All these.
And if it can't contract, the woman will bleed.
The woman will bleed.
It will-
Sometimes they know what to do, but they don't have the resources.
Yeah.
They don't have equipment to work with. They don't have nothing to work with. So it makes the work difficult. But for us, we have to wait when they complete the distribution for all of the other counties, and they come to Montserrado and give us what is left, which most of the times is not adequate enough. As I speak to you, most of our facilities are almost shutting down. Redemption Hospital, they don't have anything currently. So when a patient come, very critical. If you are pregnant woman come in with severe preeclampsia or eclamptic patient and convulsing, and the midwife don't have anything to work with.
This is what's
May I
happening
just-
today?
As I speak to you, it's happening today. Okay, go get oxytocin. Sometimes they have to run for 30 minutes or so to go to one, the nearest drugstore available, and get it to come back to the facility so that they come back too late.
I just want to understand family planning in Liberia. Is that part of what you try to provide?
Yes, we provide family planning in Liberia. We make the pills available. We also give Chadel insection. We do IUD, intrauterine device, as well.
You were mentioning earlier that for many women, their husbands are not supportive of birth control.
Yeah.
And so if they take a pill, then they may even have be beaten
Problems.
or they have domestic abuse issues.
Yeah.
In many instances, you have, especially the woman need to be engaged. After the discussion, she would say, okay, let my husband be involved in the process, and then the both of them can be talked to, and then explain the importance why they should have space, space the children, which of course some of them try to buy in, but in many instances it's actually difficult. They won't have to, hide to go through the process, in many instances.
So
Is
some of
there-
them will opt for
Yeah.
the chattel. In a way, the husband won't know.
Oh, no.
So we put an insertion in for 5 years. At least she'll be safe for 5 years. She won't get pregnant. So most of them want that.
Has the United States government supported family planning?
Yes.
And during the Trump administration, has that still continued, or has there been a restriction of funding?
So yeah, there has been a restriction, like I said, the USAID funding, the FARA funding. So with the Trump administration, most of the funding has reduced significantly. So currently, they're focusing on only 3 major counties now: Bong, Nima, and Lofa.
So they're not supporting.
They're really not supporting anything.
Montserrado,
in
which is the
Montserrado,
largest
yeah.
county.
So most of the family planning commodities we have, the commodities we received long time ago, between 16 and 18. Most of them, when they get pregnant, what happened to them? They go to have abortion, unsafe abortion. So when they go and have unsafe abortion, they end up perforating their uterus,
Yes.
becoming septic. When they have overwhelming sepsis, then they present to the facility and lie and say, oh, I was pregnant, but I got on a motorbike, and when the motorbike bounced, I started bleeding. But you as a doctor or an obstetrician, when you go and examine her, you realize that, hey, this thing happened 2 or 3 weeks ago. And one of the reasons I'm passionate about maternal health is because I almost died myself. I was also a victim. I was about to graduate from medical school. I got married, and then I got pregnant. So I worked in JFK, but then I saw my obstetrician as scheduled. In fact, the fact that I was in the hospital when I eat and even get excited, I said, oh, I want to see my baby. I go and they do an ultrasound, and the midwives would touch me, and the doctor would see me. Unfortunately, by 36 weeks, my baby died. I didn't know. I felt uneasy, and then I decided to go to the midwife as usual and to the doctor. And then the midwife said, oh, maybe you have malaria. I told her I feel heavy, and I don't feel my usual self. And then they told me, okay, go and run your lab. I ran a lab. This other doctor saw me, and after I explained, so for me, one of the lessons I learned from that is that once a pregnant woman come to me, that been feeling good, and then she says, I feel bad. I don't feel myself. Listen to her baby heart. See if she's doing good. But he only touched me and said, oh, you big, we will do surgery. I said, if we're doing surgery, then we're planning to do the surgery now instead of waiting. But I want to believe that particular day, I was having an abruption. Concealed abruption placenta.
That means when the placenta tears
Separated,
away.
yeah, prematurely. And nobody saw it because it was concealed. No bleeding, nothing. But I just felt heavy. And I went home. And I felt heavier. And I called this doctor and said, I feel bad. I think I need to come to the hospital. We went back and forth almost the whole day, and I insisted that I was going into the hospital. And he said, oh, they'll wait till tomorrow. I said, no. If I had waited, I would have died overnight because I was bleeding internally.
Yeah, that's what you're feeling. Yeah.
And nobody caught it. And these are some of the things that happened to other women. I was persistent because I know my body, and maybe because I'm at this level. But what about women that didn't go to school? They don't understand anything.
They don't know how to advocate for
Nothing.
themselves.
Yeah.
And then he tells me, go, yeah, the internet's doing ultrasound. I went and the internet said, oh, I'm sorry. I don't see your heartbeat. And then they said, go home. I said, yeah, no. I'm going to stay in, you will do a surgery and remove this baby because I don't know why the baby died. I'm not going home. And he comes in. Went in the OT to do a cesarean section. It took 4 hours to do the cesarean section because my uterus have become blue, almost blackish. I bled almost all the blood in my body. My baby died. And they couldn't stop the bleeding. He had to send for another doctor that came. And they had to like keep all my uterine artery and all that just to get me out of the hospital. And afterwards, I developed hemolytic uremic syndrome. I almost died. That's why I'm passionate about maternal health. If I have to save just one woman, I do it because I too am a victim.